Hello, and welcome to the 2025 Annual Enrollment Presentation for Medicare Retirees. This presentation will go over plan changes and reminders that you need to be aware of for 2025, your responsibilities as an OGB plan member, your 2025 plan options, how to enroll, wellness and disease management options, term life insurance, and contact information. So let's start with plan year changes. Effective January 1st, 2025, there will be a 6.65% rate increase for the Louisiana Blue, Pelican, and Magnolia plans. There will be a new life insurance option available to all OGB members, also effective January 1st, 2025. OGB will begin offering the Enhanced Basic Term Life Insurance option with a max payout of $15,000 for the primary plan holder. There will be more information about this coming up later in the presentation. The Inflation Reduction Act changes. Also effective January 1st, 2025, Medicare retirees will have a cap of $2,000 on their out-of-pocket spending for prescription drugs. And just a reminder that no action is necessary if you would like to remain in your current OGB health plan for 2025. If you receive mail at a post office box, Medicare requires you also provide OGB with a physical or street address. You can call, email, or mail this information to OGB to make that update. During annual enrollment, OGB plan members can do the following: enroll in a health plan, increase from basic to enhanced basic term life coverage, drop or add dependents, discontinue the OGB term life insurance, or reduce from the basic plus supplemental to basic or enhanced basic term life coverage. Or you can discontinue your OGB health coverage. If you discontinue your OGB health coverage in retirement, you cannot get it back. Now let's go over your 2025 plan options. Let's start with learning more about Medicare Advantage. What are the advantages of enrolling in a Medicare Advantage plan? Well, most Medicare Advantage plans have low monthly premiums, and some have no monthly premiums. Some plans may provide more benefits than are covered under traditional Medicare, and you can generally enroll regardless of your medical history. It is important to do your homework and compare plans, though. Medicare Advantage benefits and provider networks can vary from one plan to another. So before enrolling, you need to make sure the benefits and rules of the plan you select meet your needs and budget. Also, please be careful of TV advertisements and mail or phone solicitations for Medicare Advantage plans. If you are unsure about any communication you receive concerning Medicare Advantage plans, please call the OGB customer service line. They will be able to tell you if the plan is an OGB sponsored plan or not. It is also important to note that if you choose an OGB sponsored Medicare Advantage plan, you will retain the option to return to an OGB sponsored plan during the next annual enrollment period. OGB offers retirees with Medicare several Medicare Advantage options. And again, these are options: Blue Advantage, Humana, People's Health, and Via Benefits. And again, if you choose an OGB sponsored Medicare Advantage plan, you do retain the option to return to another OGB sponsored plan during the next annual enrollment period.
Welcome, OGB members. Here you'll learn more about your local choice in Medicare Advantage, Blue Advantage HMO from the Cross and Shield. You'll find out more about the Medicare Advantage plan from Blue Cross and Blue Shield of Louisiana, created exclusively for you. This video should be considered only a guide. In case of any differences between this video and benefit plan documents, the final plan documents will determine benefits. At Blue Cross and Blue Shield of Louisiana, we've been protecting Louisianians for 90 years. Now with Blue Advantage, you have a local choice for your Medicare coverage. If you're a retiree and you have Medicare Parts A and B, you're eligible for Blue Advantage. Also, spouses who are Medicare eligible can enroll as well. Contact your plan administrator or refer to your plan documents to understand your contribution for this plan. This is an HMO plan, so you must live and get your healthcare services within the state of Louisiana. You will be covered for emergency services when you're out of the state. Enjoy the ease of medical, hospital, and prescription drug coverage, along with dental, vision, hearing, and fitness in one simple plan. Plus, you'll receive a Flex card to use at major retailers or online for prescription hearing aids, eyeglasses, or contacts, and over-the-counter health-related products. Now, you'll have the simplicity of one member ID card. That can mean no more confusing coordination of benefits. Just put your Medicare card away in a safe place and start using your Blue Advantage member ID. This will be the one card you'll need to get your healthcare benefits. Here are some highlights of the benefits you'll enjoy with Blue Advantage, such as no-cost preventive visits for your yearly wellness visit and a $0 copay for vaccines like flu, pneumonia, and shingles. You'll have a $0 copay for outpatient surgery and to see your primary care provider. Urgent care visits have a $10 copay. Also, you can see a specialist in our network for a $20 copay, and no referral is required. You'll have a maximum out-of-pocket of $2,000 for copays, coinsurance, and other costs for Medicare-covered services. And your ceiling for covered prescription drugs is $2,000. Plus, there's a $0 medical deductible. The doctor will see you now from home. With Blue Advantage, you'll have the option of telehealth visits from your computer, smartphone, or tablet. You'll keep moving with your no-cost fitness membership. Visit a local gym near you or get access to exercise options on your computer or device. The choice is up to you. Choose the safety and convenience of mail order and 3-month fill options for most drugs that we cover. Plus, there's a $0 pharmacy deductible. Blue Advantage is a perfect fit for some retirees, but not all. Before you make your choice, ask yourself these questions. Which doctors, clinics, and hospitals do you visit? Are you prepared to stay in-network? Staying in-network is very important. As long as you receive care within your network, you will pay less than if you receive care out of the network. Out-of-network care is covered only in emergencies. What prescription drugs are you taking? Are they covered under this plan? Also, are you getting extra benefits that will help keep you well? Still not certain if your doctors are in the Blue Advantage network or if your drugs will be covered? Call us at 1-833-955-3821 to find out. Does this plan sound right for you? Are you ready to enjoy the added benefits Blue Advantage offers? Refer to your OGB Medicare Advantage Enrollment Guide to find out more. Also, if you'd like to enroll in Blue Advantage, please contact OGB directly.
Hello OGB members. The Humana Group Medicare Employer Plan is available to you through the State of Louisiana Office of Group Benefits. The Medicare Advantage plans offered through OGB combine Part A, Part B and Part D in one plan administered by Humana. Everything covered under Original Medicare is also covered under the Humana Medicare Advantage plan. Your Medicare Advantage plan also gives you access to wellness, clinical and educational programs at no additional cost. With this plan, you have the ease of one card and one place to call with questions. The Humana plan is an HMO plan. This means you'll need to select a primary care physician or PCP from our broad Louisiana network and work with them to coordinate your care. When necessary, your PCP will provide referrals to other in-network providers. With this plan, you have no co-pays for preventative care, nationwide emergency coverage, and an out-of-pocket maximum for medical expenses each plan year. The HMO plan has set benefits. There is no annual deductible, and the most you will pay out of pocket for eligible medical expenses in a plan year is $2,000. You have a $0 copay for outpatient hospital visits. You have a $50 copay per day for inpatient hospital care, up to the first 10 days. There is a $0 copay for primary care visits and a $10 copay for specialist visits. If you have a medical emergency, you pay a $50 copay for an emergency room visit or $0 to $10 copay for urgent care. Your plan also includes routine coverage for hearing, vision, and dental. Please refer to your enrollment guide for more information on benefits and services that aren't listed in the grid. The Humana plan also includes Part D prescription drug coverage, where each type of prescription is broken out into a category or tier. You will pay different amounts depending on the type of drug, if it's a 30-day supply or a 90-day supply, as well as if you pick up your prescriptions in person from a standard retail pharmacy, or if you choose to use mail-order delivery, like Humana's mail-order pharmacy, CenterWell. There is a cost savings opportunity if you get a 90-day supply through mail order. You pay the listed co-pays for prescription drugs until your out-of-pocket costs reach $2,000. Then, Humana pays 100%. Humana also offers supplement benefits to you at no additional cost. With Go365, Humana makes wellness fun and easy. Complete eligible healthy activities like walking, getting your annual wellness visit, or volunteering to earn rewards to redeem for gift cards. Once you've earned at least $10 in rewards, choose your gift cards in the Go365 mall. Silver Sneakers is a total health and physical activity program that helps you get fit the way you want by providing access to fitness locations nationwide. Humana strives to make healthcare easy so you can manage conditions before they become more severe. Humana's specialized programs provide dedicated care managers for those with qualifying conditions along their health journey. We also help support our members after they've been discharged from an inpatient hospital or skilled nursing facility stay. We provide personal home care to assist with activities of daily living, transportation to follow-up appointments, and meals delivered right to your door. Thank you for taking the time to learn more about the Humana HMO plan offered through OGB. Refer to your 2025 enrollment guide to find out more.
Join People's Health. You'll never be sorry. It has everything you could need or want in a program with Medicare.
Thanks, Peggy. We love hearing this from our plan members because helping our members is our #1 goal. Founded by physicians and medical providers in 1994, People's Health focuses solely on helping people with Medicare, and our success is built on the individual attention we give our members. We are part of the United Healthcare family of plans, and we share a commitment to helping our members live happier, healthier lives. People's Health offers Medicare Advantage plans. These are plans that include more benefits than original Medicare, at no additional cost to our members. Medicare Advantage plans are also known as Medicare Part C. They combine your Part A hospital coverage and your Part B medical coverage for services like doctor's visits and outpatient services into one plan. And most People's Health plans also include Part D prescription drug coverage. When you join a Medicare Advantage plan, you still have Medicare, but your benefits are administered by a Medicare Advantage organization, like People's Health. The Centers for Medicare and Medicaid Services, or CMS, regulates and oversees Medicare Advantage plans. With People's Health, you can enjoy great benefits like primary care doctor visits, urgent care, specialist visits, virtual doctor visits, and many of the preventive care, screenings, and services you use most. Remember, if you travel, you're covered for emergency and urgent care worldwide. And with the United Health Passport program, you can get covered medical care at in-network costs from participating providers across the U.S. You also get those additional benefits not covered by Medicare, like routine vision with an allowance to spend toward eyeglasses or contacts, coverage for hearing aids, comprehensive dental that includes cleanings, exams, dentures, and more, no cost for home-delivered meals after an inpatient hospital stay, and respite care services for members with dementia, including Alzheimer's, plus a fitness benefit that gives you free access to network fitness centers, online fitness classes, and resources to support your brain health. And with People's Health, Part D drug coverage is included, with coverage for all drug tiers through the Medicare Part D coverage gap. It's an all-inclusive package, making it easy and convenient to get the care you need. No need to file claims to get reimbursed. You just present your People's Health ID card. People's Health has one of the largest networks of doctors, nurse practitioners, and specialists in the state, and they're always adding more. Additionally, People's Health Group Medicare also has an out-of-network benefit that lets you see providers that are out of network for certain services, although doing so may incur higher costs. If you'd like to research our plans online, visit peopleshealth.com. We make it easy for you to review plan benefits and look for network doctors and providers. You can also search for prescriptions to see what's covered. We're confident that when you review and compare all the People's Health benefits to the other Medicare options out there, you'll see the advantages of People's Health. And we hope to see you soon as a People's Health Plan member. Thank you for your time and interest in People's Health, your Medicare health team.
This is Betty, and she liked everything about the idea of retirement, except figuring out Medicare insurance. That gave her a headache. There are no shortages of retirement plans and discounts offered to her, but she couldn't make sense of what was best for her. Then, Betty found Via Benefits Insurance Services, a trusted Medicare marketplace partner, through her employer. Via Benefits takes the complexity out of choosing the right Medicare plan, and our assistance is at no cost to you. Betty was impressed with the variety of high-quality Medicare Advantage, Medigap, and prescription drug plans available to her. Via Benefits took the time to understand Betty's healthcare needs and concerns and showed her a selection of affordable plans. They even helped her apply. Now, Betty's head is clear and ready for what she really ought to be thinking about. Via Benefits is a simpler way to get Medicare coverage. We're here to help, and our assistance is at no cost to you. Visit us online or call today.
If you are interested in learning more about the options available to you through Via Benefits, we encourage you to reach out to one of their licensed benefit advisors Monday through Friday, 8 a.m. to 8 p.m. at 855-663-4228. It's also important to note that if you enroll in a plan through Via Benefits, enrolled retirees do receive a tax-free HRA, or a health reimbursement arrangement, for qualifying medical expenses. For a retiree only, it's $200 a month, and for a retiree plus spouse, it's $300 a month. Here you will see a few of the plans available through Via Benefits. This is just a sampling. The plans offered are vast. So we encourage you to visit my.viabenefits.com/OGB or call Via Benefits to talk to a benefits advisor. Now, the Medicare Advantage plans are options. They are not required. If you do not wish to be in a Medicare Advantage plan, you can also select from one of the 4 OGB self-funded plans. Those are the Pelican HRA 1000, the Magnolia Local Plus, the Magnolia Open Access, and Magnolia Local plans. Now let's watch a few videos about each of these offerings.
The Pelican HRA 1000 health plan has the second lowest monthly premiums of any OGB plan. It offers a health reimbursement account, or HRA. You can use it to pay for health expenses like coinsurance and co-pays. OGB will fund a set amount in your HRA, about half of your deductible, and use it to pay for your out-of-pocket medical expenses. When you get care, Blue Cross will get the bill and use funds from your HRA to pay your portion. When all the money in your HRA is used up, you will get the bills to pay out of pocket. Any money left over in your HRA at the end of the year stays in your HRA, as long as you remain with the Pelican HRA 1000 plan. This plan has a deductible. Once you reach this amount, OGB will pay 80% of your healthcare costs for in-network providers. It has an out-of-pocket maximum. When you reach it, the plan will pay 100% of your qualified care. This guarantee helps you know you won't pay more than a certain amount for health care during the plan year. Pelican HRA 1000 uses Blue Cross's large, statewide preferred provider network. And you can access the Blue Cross Blue Shield Association national providers. Pelican HRA 1000 also offers out-of-network coverage which can be helpful if you travel or need highly specialized care. OGB members who are active employees or retirees can choose Pelican HRA 1000.
The Magnolia Local Plus has the second highest premiums of the OGB health plans. But in exchange for higher upfront cost, it offers set out-of-pocket cost, which could be lower than other plans. In Magnolia Local Plus, many covered services offer co-payments. This will keep what you pay at the doctor's office or other facilities predictable. There are some services that use co-insurance, including diabetes treatment, dialysis, emergency medical services, and durable medical equipment. These services are subject to a small deductible for active members. Once you reach this amount, OGB will pay a large portion of your healthcare costs for in-network providers. There is no deductible for retirees who retired before March 1st, 2015. Magnolia Local Plus has an out-of-pocket maximum. Once you pay this amount in co-payments and co-insurance, OGB will pay for 100% of your qualified care. This guarantee helps you know you won't pay more than a certain amount for healthcare during the plan year. Magnolia Local Plus uses Blue Cross's large, statewide preferred provider network. And you can access the Blue Cross Blue Shield Association national providers. Magnolia Local Plus does not offer out-of-network coverage. OGB members who are active employees or retirees with or without Medicare can choose Magnolia Local Plus.
Magnolia Open Access combines moderate deductibles with a nationwide network to make it an attractive plan for members who live out of state or travel regularly. However, premiums for the Magnolia Open Access plan are higher than OGB's other plans. Open Access differs from the other Magnolia plans. In Open Access, you will not pay copays at healthcare provider visits. Instead, once you meet your deductible, you will pay co-insurance for most services. Along with a moderate deductible, Magnolia Open Access offers reasonable out-of-pocket maximums to help keep your out-of-pocket costs lower. When you reach your out-of-pocket maximum, OGB will pay 100% of your qualified care. Magnolia Open Access uses Blue Cross's large, statewide preferred provider directory, the Blue Cross and Blue Shield Association National Providers Directory, and out-of-network coverage. Some OGB members can be eligible for Retiree 100 as part of Magnolia Open Access. Retiree 100 coordinates with Medicare to offer additional coverage for extensive hospital bills and physician charges. Members must have Medicare Parts A and B and very high medical costs. OGB members who are active employees or retirees with or without Medicare can choose Magnolia Open Access.
Magnolia Local combines lower monthly premiums with set out-of-pocket costs to create an exciting option for OGB plan members. We can do this by offering select networks powered by the state's largest healthcare providers, Ochsner Health Network, Christus, Baton Rouge General, and the Baton Rouge Clinic. In the Magnolia Local plan, many covered services offer co-payments. This will keep what you pay at the doctor's office or other facilities predictable. There are some services that use co-insurance, including diabetes treatment, dialysis, emergency medical services, and durable medical equipment. These services are subject to a small deductible for active members. Once you reach this amount, OGB will pay a large portion of your healthcare costs for in-network providers. There is no deductible for retirees who retired before March 1st, 2015. Magnolia Local has a low out-of-pocket maximum. Once you pay this amount in co-payments and co-insurance, OGB will pay for 100% of your qualified care. This guarantee helps you know you won't pay more than a certain amount for healthcare during the plan year. Magnolia Local is available to active employees and retired OGB members who live in the New Orleans and North Shore area, Lafayette and Acadiana, and Caddo and Bossier parishes. It is also available to members in the Baton Rouge area. Magnolia Local does not offer out-of-network coverage.
You can learn more about your health plan options on the OGB Annual Enrollment website. That is annualenrollment.groupbenefits.org. There you will find the enrollment guide for 2025 and other information that is helpful for when you are making your decision during annual enrollment. So now that you know more about the plans, let's talk about how you can make changes. Retired employees can enroll or make changes through one of the following options. To enroll in a new health plan with the same covered dependents as 2024, you can use the OGB Annual Enrollment Portal, you can use the Annual Enrollment form that was in the book you received in the mail, or you can contact OGB. If you're wanting to enroll in a health plan with different or new covered dependents than 2024, you're going to need to reach out to OGB. To increase to or decrease to the enhanced basic life option, you need to contact OGB. To drop health coverage and or life insurance coverage, you need to contact OGB. If you wish to enroll in an individual Medicare plan through Via Benefits, you need to contact Via Benefits or visit their website. Now please remember, if a retired employee discontinues their OGB coverage, they cannot get it back. So you need to make sure that the option you choose is right for you. Members wishing to change health plans with the same covered dependents as their 2024 plan are eligible to use the OGB Annual Enrollment Portal to make their 2025 selection. To use the portal, you will follow the links from the OGB homepage to the Annual Enrollment Portal. Once you get to the Annual Enrollment Portal, you'll choose Step 3, choose your plan, and then click on the blue box that says Non-LeGov employees and all retirees. Also, if something happened to your enrollment guide, you did not get it, or you spilled coffee on it, or something like that, we do have copies of the paper enrollment forms on the Annual Enrollment website for you to print off and send in. If you decide to use the portal, you will log in using your last name, your date of birth, the last 4 digits of your social security number, and your zip code. First thing you're going to do is confirm your contact information. This is very important. Once you confirm that information, you'll make your health plan selection. Again, remember, enrollment in Via Benefits is not available through this method. You have to reach out to Via Benefits in order to enroll in one of their plans. Next, you're going to review your selections and either click Confirm to save them and view your confirmation page, or if you've made a mistake or changed your mind, you can click Change, go back, revise your selections, and then click Confirm to save them. When you get to the confirmation page, we highly encourage you to print it, email it, or save it for your records. Now let's talk about wellness and disease management. We do care about the health and well-being of our members, and that's why we offer several wellness and disease management programs to them. First, we have Live Better Louisiana and Blue 365. So let's watch a quick video about the Live Better Louisiana program.
Live Better Louisiana is OGB's game plan for better health. The Office of Group Benefits and Louisiana Blue sponsor LBL at no extra charge to you. In fact, it can save you money. All primary members, active and retired, with OGB Louisiana Blue health plans can get a Catapult Health checkup through Live Better Louisiana. Members of OGB's Medicare Advantage employer plan cannot take part. You can earn a $120 a year credit on your OGB Louisiana Blue premiums for the next plan year if you complete your Catapult Health Clinic checkup, or get a checkup with your primary care doctor and send in a completely filled out PCP form. Clinics are scheduled across the state. You can see them all at timeconfirmed.com/OGB. For more information on Live Better Louisiana, the premium credit, or to download a PCP form, go to lablue.com/OGB, select your health plan, and click Wellness.
Now let's learn a little bit more about Blue 365. Blue 365 is a health and wellness discount program that is free to join for all OGB plan members. Examples of discounts that you can receive by signing up for Blue 365 are discounts on Crocs, hearing aids, vision coverage, dental coverage, meal planning, vacations, and gym memberships. You can sign up for Blue 365 at www.blue365deals.com/Louisiana Blue. Moving on to term life insurance. As I mentioned earlier in the presentation, OGB will be offering 3 term life insurance plans through Prudential. Those are the Basic, Enhanced Basic, and Basic Plus Supplemental Term Life Insurance options. Under each plan, there are 2 options for the member to choose from. During annual enrollment, OGB will allow retirees the one-time opportunity to drop from the Basic Plus Supplemental coverage to the Enhanced Basic coverage for an effective date of January 1st without providing evidence of insurability. If you wish to increase coverage from Basic coverage to Enhanced Basic or Basic Plus Supplemental, you are required to provide that evidence of insurability. You can visit the link or scan the QR code to complete that evidence of insurability form online. A few reminders about changes to your life insurance. January 1st, following your 65th birthday, there is a 25% reduction of coverage. There's another 25% reduction in coverage January 1st, following your 70th birthday. Your premium rates will be adjusted accordingly, and you can look at the updated life insurance rate sheets at info.groupbenefits.org/life-insurance. Now let's go over some contact. If you need assistance from one of our vendors, you can reach them at the contact numbers and websites below. For Louisiana Blue, their customer service line is 1-800-392-4089. Blue Advantage can be reached at 1-866-508-7145. Humana's customer service line is 1-877-889-9885. You can reach out to People's Health Customer Service at 1-866-912-8304. If you have questions about your Part D prescription drug coverage, you can reach out to SilverScript at 1-888-996-0104. And again, if you have questions or want to learn more about VIA benefits, you can reach out to them at 1-855-663-4228. And as always, you can find more information at the vendors' websites, which are listed here on the screen. If you need to get in touch with OGB, we have several options available to our members. Our website is a wealth of information, and that is info.groupbenefits.org. During the annual enrollment period, you can also learn more information about the 2025 plan year options at annualenrollment.groupbenefits.org. We are also on social media, and we do encourage you to follow us there. So on X, which is formerly known as Twitter, we are at OGB Louisiana. On YouTube, we are State of Louisiana, Office of Group Benefits. And on Facebook, it is Louisiana Office of Group Benefits. Our customer service line is available Monday through Friday, 8 a.m. to 4:30 p.m. That phone number is 1-800-272-8451. or you can email customer service at ogb.customerservice@la.gov. We are located in downtown Baton Rouge behind the state capitol in the Claiborne building. That address is 1201 North 3rd Street, Baton Rouge, Louisiana 70802, and we are in Suite G159. Thank you for watching this video. We encourage you to review your options in the enrollment guide that you received in the mail, and then take action to choose what is best for you and your family, knowing that all of our staff here at OGB are working hard every day to maintain this valuable benefit for you. We look forward to serving you and your family in 2025.